Thank you all for joining us today for our webinar about the Nebraska Early Childhood Strategic Plan. I am Hallie Duke. I work with the Buffett Early Childhood Institute to guide the process of developing a strategic plan for the early childhood system in Nebraska. Joining me in hosting this webinar today are Susan Sarver and Sara Vetter.
Good morning, everybody. I'm Susan Sarver. I am the Director of Workforce Planning and Development at the Buffett Early Childhood Institute, and I'm the Principal Investigator for the strategic plan through the Preschool Development Grant. I look forward to talking to everybody this morning.
Hi, everybody. I'm Sara Vetter, and I also work at the Buffett Early Childhood Institute as a project manager on the strategic plan activity funded by the Preschool Development Grant. I'll be monitoring chat if you have any questions or need any technical assistance.
Thank you. We want to let you know that we will be having an interactive format today. So if you have a smartphone or a tablet nearby or can open another window on your screen, we'll be giving you some instructions about how to respond to our interactive questions. And there will be an evaluation that you will receive at the end of the meeting. We'll walk you through all of this and you'll hear more about it as we go. Our purpose for the webinar, we have several purposes, so several goals. Generally, we want to increase enthusiasm. We want more and more people to understand the strategic plan and the planning efforts that are coming. We want to help people get a more in-depth understanding of the plan. It's a long and complicated document, so it's helpful, we think, to have this time to talk together about it. We also want to promote readiness to participate in upcoming meetings where we will engage stakeholders to get more input on the plan. And we want to gather input from more voices to improve the plan. Today, we're going to ask you for some initial feedback, but over time, our efforts are really to expand the perspectives that are represented in the plan. Sara is going to put a link to the strategic plan and to the values document in the chat area, and these may be helpful for you to reference later on during the presentation. Because this webinar is intended to improve your understanding, we have 4 learning objectives. First, to help you get familiar with what the plan says, to get familiar with the terms, understand the values, and the background of the goals and the strategies. We also want to help you relate the content of the plan to your work and to prepare you to share the plan with others as we move into a broader stakeholder engagement process. These learning objectives are meant to prepare you to be our partners in developing the strategic plan. At the end of the webinar, you will receive a survey that will give you the opportunity to give direct feedback about the plan and to evaluate this webinar. On the cover of the executive summary, it states that the Nebraska Early Childhood Strategic Plan is a dynamic plan by and for Nebraskans. Well, what does that mean? What makes it dynamic? Well, it started in 2019 with a major statewide needs assessment process. Work continues today in conversations with families, providers, and other partners to identify and address priorities for action. We will keep bringing new information to you about families and providers' needs, and that means the plan is going to continue to evolve. What does by Nebraskans means? Well, we took those findings from the earliest needs assessment out to stakeholders across the state and asked them to identify priorities for filling gaps and addressing needs. Those conversations led to the goals and objectives you see in the plan today. We will continue conversations with more stakeholders to refine the plan, with an emphasis on identifying strategies that meet the needs of unique and diverse communities across the state. And it was created for Nebraskans. The plan focuses on changing the systems that serve families and children. The vision, which we will review next, aims to improve access to quality care for all families and children. Conversations with stakeholders will include questions about what success looks like and how changes can be measured. helping to ensure that Nebraska has the capacity to evaluate progress and to make data-informed decisions about how to improve early childhood services. This integrated and collaborative approach to needs assessment, strategic planning, and performance evaluation will help ensure that Nebraska creates sustainable change at the community and state levels.
In keeping with the spirit of by and for Nebraskans, we want to make this webinar interactive, and we want to start getting some feedback from you that we'll incorporate as we continue moving on. So whenever you see this amazing little smiling face, this is your cue that we're going to be using Menti. So if you take your smartphone, another window, your tablet, and open up a web page and go to menti.com, menti.com, it will ask you to put in a code, and then you type in the code 47516917. It's going to be the same code each time, and if your phone goes to sleep or the window goes to sleep, all you have to do is wake it back up and you'll see the next set of questions. So the first two questions are kind of a pre-test and to give us an idea about where you are now. And we're going to ask you these again at the end of the webinar after we go through everything. So for our first question here, we would just like you to give us 1 or 2 words how you feel about the strategic plan. Now the answers are going to start coming up on the screen. These are all anonymous. We don't know who puts in what. What we see on the screen is going to be a summary, and it's going to create a little word cloud of all the words that we're getting as we come through, as they're entered in. And we'll give everybody just a couple of minutes to start getting those words in.
I love this word cloud thing. It's not getting old. Okay, I see some honesty here. There's one apprehensive.
Mhm.
We've had words like stressed and confused before at previous webinars, and that's understandable because there's an awful lot being presented here. I do also, I like seeing the word curious. That's a new one for to be big right there in the middle. So that means a lot of people are curious. And curious is a great opportunity to learn.
That Menti code will always be at the top of the screen, 47516917 for each of the questions also. Okay, so hopefully here as we get to the end of the webinar, you won't be as apprehensive, and we will have satisfied some of your curiosity. And I think these other words that are coming in here, hopeful, research-based, quality, child-centered, you'll see that those are indeed in the strategic plan.
Yeah, that's great. Okay, thank you.
The next question that we have for you on Menti is a series of questions about the learning objectives for the strategic plan. So what you'll see when you go to Menti, and Hallie will be changing the screen here in just a second.
That slide.
Here we go. Our 4 questions, just asking you about the strategic plan and how you feel. So this is a 0 to 5 scale, and all you have to do is choose with your finger or mouse somewhere in that scale where you feel you are for each of these, from strongly disagree to strongly agree. And again, all the results are going to come in, but they're all going to be anonymous. We just get the average that we'll see starting to pop up here on the screen in a few minutes. And we usually do see a wide range in this because we have a lot of people who are really familiar with the strategic plan, and a couple of folks who are like, yeah, I heard about it, or what in the world are you talking about, sort of things. So we have a big variety here, which is actually very exciting.
And we know it's certainly fair to not quite yet be ready to share the plan with a lot of people in your world because you haven't had a chance to learn about it. Hopefully we will also remedy that in the next hour, and you'll feel far more confident and be ready to engage with us. So thank you so much for helping us understand where you are with the plan as we get started. As Susan said, we're going to test the effectiveness of the webinar by re-asking those questions, as well as sending you an evaluation via email. So let's get started with the vision of the strategic plan. And that is all Nebraska children and their families have access to quality early childhood services that support children's healthy development from birth through age 8. Now, we've packed a lot of concepts into that statement, so let's break it down and take a closer look. We're going to start with the phrase all Nebraska children and their families. The vision places children and families at the center of the work, all types of families. The vision calls us to ensure that no matter where a family lives or in what challenges they face, each child in Nebraska can access quality early childhood education and other essential services. Now let's look at what we mean by early childhood services that support children's healthy development. Note that access and quality are very important concepts, and we are going to return to those in just a minute. These services include early childhood care and education services, as well as other services that are essential for children's healthy development, including the full range of healthcare and social services. This understanding of the early childhood system has been defined in the strategic plan as a mixed delivery system. You can look at the mixed delivery system and read more about it on page 6 of the strategic plan executive summary. The last phrase in the vision is from birth through age 8. While various funding sources have required a focus on different age ranges, such as birth to age 3 or birth to age 5, Nebraska stakeholders told us last year that it was important to support children and their families through age 8, because this is a unique period of growth that is significant in terms of the effects of emotional, physical, and brain development that takes place in these years, and that will affect them throughout their lives. Now let's return to the concept of access to quality services. And we'll start by considering who provides access to quality early childhood services. The services in the system are provided by professionals across different categories. Early care and education providers at the top of the figure include home-based care providers, center-based providers, and school-based settings. Healthcare providers include developmental screening, disability support services, doctors, occupational therapists, mental health counselors, and dentists. Those are on the right side of the figure. Social service providers such as nutrition supports for families, programs that provide stable housing or address family crisis, and other parent supports round out the full set of services, and these are on the left side of the circle. The service providers that children and families call on exist in the communities where they live. Many people in communities have an important role in ensuring access to quality early childhood services for the children. Currently, some community leaders, schools, and nonprofit program organizations are partnering with early childhood service providers. Over time, we may see other parties become increasingly engaged, including business leaders, more school officials, and elected officials. At the state level, state agencies and elected officials are involved in decisions related to policies, funding, data management, and evaluation that determine which services are available. There are also nonprofit organizations that oversee early childhood programs and partners in higher education providing professional training for early childhood providers. Putting it all together, we have this illustration of what the state's early childhood mixed delivery system will look like when the vision is fulfilled. The family is nested in the center with coordinated and aligned systems that support them, providers, communities, and state operations. The plan is designed to implement integrated strategies that work together across goals to improve access to quality care for all family types.
So I'd like you to go back to Menti again, go back to that menti.com, and it's that same number that we had before. And now that we've talked about the vision a little bit and we've pulled it apart in some detail, we'd like you to tell us what about this vision is most inspiring to you. And you have about 50 words to actually do this. You've got a little more space here, so we're asking for more than 1 or 2 words. So a couple of phrases or sentences about what it is that you think is important about the vision. It might help to think about it about, what are your hopes you have for children that make this work compelling? Where do you see the vision taking you?
There's always a little extra pause here because it takes a minute for people to type out the extra words, not just 1 or 2.
So we'll give everybody a couple of minutes to start inputting those inspirations.
Diverse support for people in a nurturing manner. Systems changing to support the families and equity for all children and families. A comprehensive approach across systems, supporting families through and past our time with them.
Access to quality, critical to equity and equitable outcomes. That's very important.
It's inclusive. I see someone's interested in helping families across the age ranges that we've highlighted in the vision, all the way through age 8.
The emphasis on the mixed delivery system. We can't do this alone.
Community collaborations, helping children all the way through age 8.
The system's changing to support the families and equity for children and families. We're going to talk some more about that too as we go through.
Yes, we will.
So we're getting some more previews of some of the things we're going to start bringing up, which is very exciting.
It is exciting because the things that you're looking for and interested in are the kinds of things we already have built into the plan, which is an important thing that this plan does reflect stakeholder voices. What's important is that we also gather more voices because we only had about 5 or 6 months back in 2019 and 2020 to get people's ideas, but we want to be sure more diverse voices have been reflected. And this is where it starts, is you understanding about the plan and helping us get it to more audiences, to more stakeholder groups. So thank you so much for giving us that feedback. The vision is the future state that we aspire to create for Nebraska's children and families. It helps us to know what you believe is most meaningful to achieve this work. Next, we're going to shift into the goals, which describe the results of the work in the plan. By now, you hopefully are familiar with the 4 goals of the strategic plan. The work of the goals in their and their integration across the system is summed up by the statement printed on these stacking cups. Ensuring access for children and families to quality experiences in every setting requires collaboration across every community and alignment of systems across the state. Now imagine that you were looking down into the stacked cups. You'll see children with their families in the center. The work of implementing the strategic plan will create aligned state systems that support coordinated plans and services in communities and increased access to the quality services that all families need for their child's healthy development. This plan gives us a roadmap for how to address the gaps and needs that were raised in 2019 and 2020. Stakeholders gave us a great start on what strategies are needed to achieve the objectives stated in the plan. But we're not there yet. We have not built this aligned system that the plan calls for. And importantly, the plan doesn't fully represent how to get there. We need to hear from more voices and from more communities that haven't yet been reached. There are perspectives and lived experiences not yet represented in the plan that we have today. I'm going to take a moment now to introduce to you how we're going to represent gaps and barriers using this image. And now I'm going to turn on my laser pointer and to share this with you. Each of the petals around this circle represents a service. Each of these little dark tabs on the inside represent a door to access that service. When you see a petal that has it's full and it's complete and the door is whole and complete, that represents full availability and equitable access. If the petal and the door have dashed lines around them, that means that there's really not enough availability of that service in the community. If the petal is missing entirely, then there's just no availability. That service doesn't exist in the community. And if the door has a white line around it, that means the service is available in the community, but there are barriers to access to some families. We're going to talk a lot about gaps and barriers in the systems, and it's important to note that these were identified in the 2019 needs assessment and stakeholder input. We are continually expanding what we know about barriers to access and availability. These illustrations may not apply to every case. As we continue to engage with stakeholders and learn more, we will refine how we characterize these barriers. Our intention here is to illustrate these dynamics and how different families are impacted differently by barriers in the system. So now let's unpack those goals. I want to walk you through the key concepts of the goals and get to the meaning behind the concepts that drive them. Along the way, I'll share some of the findings from the needs assessment and describe the priorities that stakeholders articulated that led to those being the 4 pillars of the plan. Availability refers to having enough early care and education options in a given community. Availability is about the supply of quality early care services in a community. In 2019, findings about availability of early care and education, the 3 petals at the top, showed many gaps in home, center-based, and school-based early care. What we heard from families then, and what was experienced during the pandemic, is that many families cannot find the early childhood care services that they need. In 2019, over half of the providers that we surveyed had wait lists. Nearly 3/4 of them reported turning families away because there were no openings, and this was particularly true for infant care. And in remote rural areas, 76% of families reported having a lack of available options. We also found that when there is inadequate availability, families turn to whatever care they can find. And over 1/3 of the families we surveyed who reported vulnerabilities, and those in rural areas, they were turning to unlicensed care. Families also experienced shortages of the other types of essential services in the mixed delivery system. The availability of these services varies significantly by community, and families in rural areas indicated that some services were just not available to them. Even when early care and education is available, our findings show that some families struggle to access the care they need. Access means being able to enroll the child without having to overcome significant barriers. In addition to cost, other barriers faced by families trying to access early care and education include subsidy eligibility criteria, transportation to reach the care setting, hours of operation. This was mainly affected families who work shifts other than typical 8 to 5, and families only finding low quality options. For some families, there are barriers to other essential services in the system. One of the words you'll see used in the strategic plan is vulnerable. And we use this largely because of the federal requirements to study special populations. The grant directed us to learn more about vulnerable, underserved, and rural populations in order to better understand how to meet their needs. Understanding these families' needs is necessary to realize the plan's vision that all children will have access to quality early care and education. Using a systems lens, we are focusing on the systemic barriers that families face that make it difficult for them to access the services that they need. These conditions that contribute to vulnerability may have a negative impact on a child's development and learning. The source of these conditions will vary. The full list of conditions in our definition is found on page 5 of the executive summary. Some families may only face one of these conditions, but other families experience several of them. The more of these conditions they experience, the greater the impact there will be on the child's development. In the 2019 needs assessment, the families who reported having several of these conditions were nearly 4 times more likely to report that it was difficult or very difficult to pay for their care arrangement. These families said they were challenged by having to navigate multiple programs, processes, and different eligibility requirements to get the services they need. Barriers like complex applications and prohibitive costs means that doors are closed to families. Creating equity means changing elements in the system that keep the doors closed. When we find out why the doors are closed to some families and not to others, we can make the changes that will create equity. Creating equity for all families means opening the doors that are closed so that every family has access to the full range of services needed to support the healthy development of each child. The goals of the strategic plan are designed to change the early childhood system so that each child in Nebraska has access to quality early childhood services.
Okay, so that was a lot of information about access and equitable access. And so we want to take a step back now and let you think about what you do as part of your daily work and how that ties to the strategic plan, especially around access. So if you go back to menti.com, what you're going to see appearing on the screen is a list of activities from the strategic plan that are designed to increase access. And we'd like you to choose these activities that are part of your daily work. If you press the button next to each of the activities on the screen, it will choose the button. It's like a radio button. You just press it or click it with your mouse. Some of you may be doing lots of these or all of these. Some of you may be only doing one. And some of you may not actually be doing any of these activities because your work is elsewhere. There is an other option for those of you who are doing something different. And especially if you think of activities that aren't here or things that you think Nebraska needs to be doing more of. As we said before, there's going to be an evaluation survey at the end, and we want you to keep track of those others for us. Make a note to yourself, jot it down somewhere, and come back, and we want you to tell us about that at the end. And we have
Those
lots of others.
the answers that you'll give to other, if you can, as Susan said, if you make a note of those, that is going to be one of the important ways we start adding information to the strategic plan. Over time, we'll have this interaction, but we're going to have other meetings that are far more interactive, where we're going to compile and gather information and compare it with what's in the strategic plan. Each of the activities you're looking at now are mentioned as strategies in the strategic plan. But as I've said a couple of times, we want to make sure everything that needs to be there is there. So your answers to other are going to be our first step towards capturing that bigger picture.
Lots of exploring new funding opportunities and addressing unique needs of families with children with disabilities. Those are some exciting.
I'm looking forward to this other list we're going to get from this group today.
Sounds, this is a dynamic plan. And as Hallie said, we only had 5 months to start putting this together. So we know there's lots more strategies that need to be included. And more details in terms of the action plans for each of these strategies and objectives.
Okay, so if I advance the slide and you don't see your bubbles pop up there, know that they will still be accepted, and we'll be looking at those later. But let's go ahead and move to the next. Thank you for your responses today. So I'm going to introduce to you the definition of quality that was created with the strategic plan. Quality early care and education is defined in terms of what each child experiences and is characterized by positive and consistent interactions between the developing child and a familiar, caring adult, no matter the setting. This is a new definition, and it's grounded in the science of early brain development. Most of the prior definitions of quality have focused on the environmental characteristics that would enable a child to thrive, such as the design and cleanliness of the facilities, the curricula, and the teacher training. However, without the connection of the warm and caring adult attending to the individual needs, where the child feels safe and known, a child may not receive the benefits of the curriculum, the developmentally appropriate space and toys, or the training that the staff have received. Let's dive into the full definition of quality. To increase the likelihood that a child experiences quality, the settings need to be structured to promote the well-being of early childhood professionals. What does that look like? Promoting the well-being of early childhood professionals means that they can easily access pathways to qualifications and training that prepares them to serve children in any setting. They have access to resources that ensure that they are physically and emotionally healthy, and it means compensating them commensurate with the impact of their work. To increase the likelihood that a child experiences quality, the setting needs to be structured to foster the child's healthy development and learning. Well, what does that look like? This means that developmentally appropriate instruction is offered that engages the whole child physically, emotionally, cognitively, and socially, and is individualized to each child's unique skills and needs. It means that families are engaged in the care and education of their children as partners and in learning about their child's development. It also means that the families and the children's culture and language are recognized. And finally, it means that the facilities, whether it's a home, a center, or a school, are clean and set up to meet the needs of the little bodies. In order to deliver quality care and education, policies and assessment and evaluation tools must be adapted to prioritize the child's experience. This includes a shift to policies that enable early care and education providers to cover the costs of quality care. You may notice this is connected to the goal of increasing access to quality care. This also includes a shift in how we evaluate and rate quality of a provider. The shift will require including observation of the child's experiences of quality in addition to the observations of the facilities and curriculum offered in the setting.
Okay, thanks, Hallie. That's quite a bit of information about quality. And as you can see, it's really important in this strategic plan. We know it's really important for children and their families. So what you're going to see here on your Menti screen, if you go back to menti.com, are some of the activities that are related to quality throughout the strategic plan. And again, we want to start bringing this back to you in terms of what are some of these activities that you may do as part of your daily work. Again, some of these are really specific and some are more general, but we have that other option there for those of you who are doing some different things, or you want to make sure and tell us about something that, you know, we need to push Nebraska to engage in more of as we go through. Promoting the new definition of quality. Hallie and I love to see that.
Yes.
We are very engaged in promoting the definition of quality and the child-centered nature of it.
That is going to be pretty transformational. And we recognize that there are some challenges with using this definition in the field. Measuring it is one of the big challenges, but we think that it's still so valuable and so important in the kind of transformation it creates for the child's experience and development. And I like to see all the family engagement practices.
Lots of family engagement.
There's a need, there's a work group associated with the preschool development grant to learn more and establish more practices to have family and leadership roles in the preschool development grant. Ooh, 10 people promoting the new definition. Yay. Okay, does this officially mean we're nerds?
Probably, but we knew that before any of these webinars. But yes, we are family engagement and definition of quality. That's the perfect right there. This is a great group.
And I'm also encouraged to see how much effort is going into supporting the workforce.
Yes.
And expanding capacity to meet the needs of children with disabilities. We heard a lot about that in our stakeholder process last year, that there was frustration in how often it's difficult to meet those students' needs.
And the emphasis on the systems barriers that are there for those children.
Yeah, that's, yes. And I'm personally familiar with some of those system barriers for a child with special needs. So I'm happy to see all of this great work. All right, thank you all for your responses. It's really great to see where these efforts are going into quality. The next big concepts in the strategic plan is collaboration. The strategic plan, The strategic plan emphasizes building new and collaborative relationships between early care providers and others in the community. It includes bringing new partners to the table to ensure full representation across the community. The strategic plan emphasizes facilitating collaboration among community leaders as they identify local strengths and priorities, and to develop local plans to improve access to quality care. Finally, collaboration includes state-level partners working together to help communities in developing their plans to meet families' needs. In 2019, stakeholders repeatedly told us about limited communication between early care providers and school teachers and administrators. They described challenges like limited communication around children's needs, particularly as they supported children making the transition to kindergarten, and about limitations in sharing professional resource development. Professional development resources. Stakeholders also described some communities that had effective plans in place to coordinate resources. In some cases, several communities across a county would pool resources to meet families' needs. But they also told us about communities that had no coordination plans or efforts at all. In interviews with key informants about collaboration among state-level organizations, we learned that many were unfamiliar with other organizations' work and efforts to support communities. An important reason to collaborate is to ensure continuity of care. Non-continuous care occurs when a child must be moved between settings in a single day, week, or month because of the family's work schedule, or when a child must change settings because of limited availability in their community. Non-continuous care also impacts quality because it means the child is having to break and reform relationships frequently. Here we have a connection to the access and quality goals, as I've just mentioned. The lack of availability and access will adversely impact the continuity of care. And when there's low continuity of care, the child won't have as many stable relationships with the caring adults. Families with children with disabilities and other special needs face unique challenges to having continuous care due to their child's specific needs. A community that has a coordination plan to help families find resources will be better able to address these gaps.
So now that we've talked about collaboration a little bit, we want to go back and ask you to think about what you do in terms of collaboration. So we're going to go back to menti.com, and what you're going to see here are a list of activities from the strategic plan designed to increase collaboration. This is a smaller subset of items, as you can see. And so this is, again, really important, where we want you to think about those others, or where we want you to think about success stories. This is definitely one of the areas, as we listened across the state, where folks said there are definitely some gaps, as Hallie emphasized, but there are truly some really great success stories at the local community level where this is being done really well. And we want to start elevating those success stories. Building relationships and increasing communication. We have relationship people here.
Somebody
Family engagement and quality.
Lots of angles, because there's the community level collaboration, but there's also some folks working on this state level in ways that will help support community planning.
Mm-hmm. Creating tools to help communities. We've got several people there too, working right in that community level. It's a nice diverse group.
Mm-hmm. And as Susan said, not everybody works on every part of the strategic plan goals. So I'm keeping an eye down in the bottom right-hand corner to see how many people have offered their feedback. But so the number changes every time. There's different people responding. Do different things. Well, thank you so much. I look forward to all of your suggestions on if you have other ideas about how we can improve collaboration in the state. The last concept to review is alignment. To achieve an aligned early childhood system, a shared understanding and commitment is required by the public, by policymakers, and by community leaders about the importance of quality early childhood care and education. With that shared understanding and commitment, decisions can be made to prioritize resources and invest in systems change that ensure each child can access quality early care and education. During the pandemic, people across the country became acutely aware of how important early care and education is to the functioning of our communities and our economy. In 2019, stakeholders across the state voiced a similar theme, emphasizing that everyone needs to understand the value and impact of quality early care and education on children, on the community, on the economy, and even on the nation. While many partners work toward improving outcomes for young children, we learned from key informant interviews that sometimes organizations working in the field do not understand how their own work complements or conflicts with the work of others. With so much going on all the time, and frankly, this was before the pandemic, there just isn't always enough time or capacity to check in and learn about each other's work. Key informants also talked about the systemic barriers that stem from state-level policies and procedures, including funding and administrative policies that restrict access to services. These barriers put pressure on the providers to work the different systems to get at the funding so they can run their business rather than focusing on caring for children. A significant barrier to alignment is that Nebraska community leaders and policymakers do not have the access to the data they need to make fully informed decisions about policies, funding, and programs. Right now, Nebraska does not have data that will represent the number of families with young children who experience vulnerabilities. This makes it extremely hard to identify and plan for the needs those families have in the communities where they're living. The state also does not have data for how families are using early care and education services. That is, we don't know which families and what types of families use different types of care in different settings and why they make those choices. While the leaders are using the data that are available to make the best decisions possible, additional work is needed to implement an integrated early childhood data system that will allow leaders across the state to measure and track progress toward the strategic plan goals and toward community priorities. The strategic plan calls for developing and implementing a system of shared measurement and accountability that includes feedback loops to support continuous improvement.
So I think we may have quite a few answers of folks who are working on this alignment from what we saw before. We're going to go back again now that we've talked about alignment as one of the goals and ask you about your activities around alignment. Again, some of these are really very specific, such as integrating data systems, and others are much more general. But we want you to think about ways that you promote alignment for children and families in your daily work.
A lot of these are written at the state level, with the idea being behind the alignment goal that as things at the state level are better aligned, then communities can access and use those resources to improve the way their system works locally. So it could be that if someone's working a lot on local collaboration issues, they may not be working at the state alignment level. Ooh, I'm excited to see other bubbles popping up, because that means we're going to have some other suggestions, hopefully, for how to promote alignment.
We've got a lot more on that shared vision, sharing the quality, sharing the vision for early childhood. I think we're going to put stars by all the attendees today, Sarah, and say these are our outreach people that we're going to reconnect with.
Yes.
And we are going to be asking you at the end about groups to reach out to and, more specific ways that you can help us do some of these things that you're already doing. Tell us about how you're sharing some of these things.
Because if you're out there sharing the vision for an integrated early childhood system, then we want to be on the agenda with information about the strategic plan. So
We will hold on to your coattails.
yes, we will.
Along.
Awesome. Okay. So thank you again for your feedback about achieving greater alignment. Now let's shift to talk about how the concepts of the plan will create change. I've spoken several times about systems change. The full range of services in the mixed delivery system are necessary for a child's healthy development. When all the doors to those services are open, the child and their family can access the services they need to thrive. Closed doors represent barriers in the system. Our work is to understand the conditions that keep some doors closed. If we understand the factors that hold the problem in place, we can shift those conditions and the doors can open. Taking this systems approach to change involves 3 types of changes. The wisdom of the Nebraska stakeholders has set up a strategic plan that contains the elements necessary for systems change. The plan includes structural changes. We've talked about changes in policies and practices and resource allocation. These may be the most familiar aspects of systems change, but there's a little bit more to it. The strategic plan also emphasizes the need to build relationships and make new connections so that we're working together towards shared goals. And this will mean bringing new people to the leadership table and changing the power dynamics by allowing new voices to lead change efforts. And finally, the strategic plan also asks us to shift our mental models. For example, to change how we're thinking about quality and to ask people across the state from all walks of life to adopt a new understanding about the importance of early childhood. So how will the strategic plan facilitate systems change? Well, it's going to start with leading with our values. The values are guiding principles that shape our thinking, our decisions, and our actions. These values support our work in achieving the vision. Last year, stakeholders raised these principles again and again, giving direction not only to what should be done, but how the work should be done. In this section, you can follow along with the handout on values that you received and that Sara posted earlier in chat. The first value is equitable access for all children and families, or equity. Equity is something we have talked about already in terms of access, ensuring that each and every child, no matter their circumstances, has access to quality care. To realize the value of equity in the implementation of the strategic plan, this value must be intentionally cultivated in the development of collaborative relationships and in our efforts to align the systems that serve families. This means learning more about the diversity of lived experiences and listening to those voices, being led by those voices. It means ensuring that the voices of the people impacted by the work are involved in developing the plan, designing the strategies to implement it, and developing the methods of evaluation. The second value is a whole child approach. When we talked about quality earlier, we understood that providing quality experiences requires caring for the whole child, their unique and individual physical, emotional, social, and educational needs, and recognizing that the child lives within a family and within a community, all with unique strengths and resources and challenges. The goals of the strategic plan will be more successful if this philosophy of the whole child nested in their family and community is a central assumption of our efforts. The third value is shared responsibility for creating an effective early childhood system. There are no exceptions for who can play a role in improving the early childhood system. The toddlers of today are the educators, the police, the doctors, the plumbers, and the leaders of tomorrow. They are the wives and husbands and parents of the future. We all need them to have a great start so that they can contribute their best to their own families and communities. This means we need more people involved, more collaborators at the table involved in planning, more partners, new and untraditional partners, included in the discussion of policy, funding, and strategies to reach the goals, because these decisions will affect everyone. The next value is community leadership and collaboration. Simply put, community leaders know what will work in their communities better than anyone from the outside. They know local resources and businesses and families. They have relationships built on years of collaboration. The strategic plan calls for state programs to offer resources to support communities, but developing local plans must be driven by those who live in and know the community. And developing local plans that will truly create equitable access means bringing new leaders to the planning table, new voices to ensure that the entire community is represented. The next value, continuity of care, is not only a value to incorporate into the work of each goal, but it's also an outcome of implementing the strategic plan. As partners work together to create an aligned early childhood system, they must intentionally design changes that support more continuity of care. Only by intentionally designing it into the system will we create consistency in early education, which enables children to experience more quality, and coordinated access to the other essential services they need for healthy development and learning. Stakeholders also expressed the value of wise stewardship of resources. A great deal of work is already going on in communities across Nebraska to improve early childhood experiences. The introduction of a strategic plan gives Nebraska the opportunity to align the current resources and partnerships toward shared goals, and to identify new partnerships and needed resources to achieve those goals. With a new focus on shared goals, partners at the state level and local level can make decisions about those resources based on the best available data with an emphasis on evidence-based practices. Finally, the value of continuous improvement. An effective strategic plan is a process. It's a part of a process and a cycle. Having a plan is not enough. An effective strategic planning process depends on having data, developing plans based on the data, and evaluating the effectiveness of the implementation of the plans. The cycle goes on to use the evaluation data to shape the future implementation strategies. This creates a pathway for making sustainable systems change, defining the objectives and measuring progress over time, and then evaluating the results and adjusting plans to get better results. A continuous improvement approach to statewide plans and systems change is utterly dependent on partnerships and collaboration. Together, these values create the foundation for the work laid out in the goals of the plan.
So now we're going to ask you what is probably the most difficult question of the entire webinar. So if you'll go back to your menti.com page, we have listed here the 7 values that Hallie just talked about and how they support all of the systems change in the plan. And we would like to know the 3 values that you apply most in your work. You may be using all 7 of these. Most of you probably are, but we'd like you to choose your top 3 out of these 7 values that you use every day in your work. I have a sneaking suspicion we're going to see a lot of equity with this group.
And continuous
improvement. Whole child. People using data to make changes.
This is great.
Great information for us.
Yeah, okay. Thank you so much. So we've talked about a lot of concepts today. And these concepts really do fit together in a complex set of connections. But in the strategic plan, they also fit together logically and systematically. Well, how exactly do they fit together to create sustainable systems change? Earlier, when we took the goals apart and explored each concept, we had unpacked the goals. Well, now we're going to put them back together, restack them in the context of systems change and values. We lead with our values because they are guiding principles that shape our thinking and our actions. They give us focus on moving toward our goals to achieve the vision. So we're going to keep working together to achieve the access goal. Each child and their family can access the quality early care, education, and other essential services they need to support each child's healthy development. To achieve the quality goal, all early care and education settings provide quality experiences for children. To achieve the collaboration goal, communities coordinate a locally designed mixed delivery system that provides continuous care and meets the needs of families. And to achieve the alignment goal, statewide systems align to support communities in creating an integrated and comprehensive mixed delivery system for all children. This brings all the concepts together, the values supporting the goals acting on the system, all working together to reach the vision. Thank you so much for your time and attention today. Before you head off, there's just a little bit of information more to share and to talk about. So what comes next? These webinars are the beginning of a larger stakeholder engagement process. We will hold meetings, some will be in person hopefully, and many will be virtual, with partners and members of the system across the state. These are coordinated efforts with the needs assessment to learn more about families, early childhood professionals, and key informants. We will be bringing new information into the discussion of priorities for action. We're also coordinating with performance evaluation efforts to be sure we can measure and track progress towards the strategic plan objectives. The outcome we are targeting is an expanded and revised set of strategies and action plans that represent more voices, or in other words, an updated and expanded strategic plan. So how can you help? First, you can learn more. There's informational materials about the strategic plan available at our website, neearlychildhoodplan.org. And more information is going to be added there as the process evolves. Please dive into these materials, learn about them, and share them with your colleagues. There's a calendar of events there where you can find more opportunities to give feedback on the strategic plan and to participate in other events that are funded by the Preschool Development Grant. We also need your help to reach more people. We would like more people to become familiar with the strategic plan. One way to do that is for us to make informational presentations in different settings. Presentations like this one, but maybe shorter, where we can describe the plan. This may involve attending meetings within an organization or across a community, or attending conferences. And we also very much, as I've said, want to engage a variety of people from diverse communities. And this may be families, early childhood professionals, councils, or more groups, to capture their voices and experiences into the strategic plan. That type of gathering is going to be much more interactive and designed to capture their recommendations for strategies and action plans relevant to their lived experiences. Please help us make connections to partners who can help us reach groups and communities to participate in these feedback sessions.
Okay, so we want to go back to menti.com. And these last two questions are really for us as we do these webinars to help us think about how we did. and what we need to change. So what you're going to see first is the 4 learning objectives that we started the seminar with. And we're going to ask you to rate now from strongly disagree to strongly agree your feelings about yourself and the strategic plan. This gives us an idea of what we're doing and some of the things we need to change. So please be honest with us as you feel about these. We're getting some good ideas in chat too about some ideas about scheduling. Please let us know any of those ideas either on the evaluation form, or you can feel free to call, email, let us know some of these ideas as we start moving forward with some of these more engagement activities. As Hallie said, we are happy to co-present with you, send you information, send you copies of the strategic plan that you can use in your own meetings. Very happy to provide materials to help you do that.
And joining you at meetings where you would like the information to be presented, but you don't feel like you could be the expert and present it. It would mean a lot to be hosted by somebody who can help us find an audience, and we're happy to do that. We're used to talking about the plan all the time.
So the last question here is just going back again to 1 or 2 words to describe how you feel about the strategic plan. Now that we've taken it apart, we've unpacked all the nesting cups, we've looked at it in the context of the system, we've looked at it in the context of Nebraska values, and we put it all back together. Where are you feeling now that we've gone through all of these details? Like that excited and hopeful again.
Mm-hmm.
Inspired.
Ready. I like ready. That's good. We need you to be ready. So I'm going to figure out a way to compile all the word clouds from all the webinars so that we can have one final answer for how this went for people.
In the next few minutes in your inbox, you're going to be getting a survey from us. I can't remember if it comes from my name or Sarah's name. And Sarah's also posting a link in the chat box. And this is an evaluation form for us, just to give us some overview about all of these things, and really to give you a chance to give us even more detail about some of these things, some of those other questions that or other options you may have had in there, or other things that come to your mind. Please include those on that evaluation survey, and those will come back to us so that we can start pulling these ideas together.
You can certainly go ahead and fill out your evaluation while you have the time blocked on your calendar, but we will stay here on the call for a few minutes. If anybody wants to ask questions or give us some direct feedback, we'd welcome that. But you're also free to go carry on with your day.
Thank you everyone for your time this Monday morning.
Thank you so much.
It can be early and hard to get started on Monday, but we're excited to share the strategic plan with you today.